Hey, so I found something we need to audit. And this is due to, I guess, pharmaceutical companies wanting to get rid of 340B initiative in the Public Health and Safety Act because they think that they aren't getting their payments and that this program is making it super easy for people to basically double dip. This program is to help people who are in rural areas, indigent areas, urban areas, and people who are underserved, underinsured, and uninsured get medications at a cheaper rate based on the agreement between pharmaceutical companies and the government. It's a whole program. I am totally for this because if people can get the medication that they would otherwise not be able to afford, totally for it. Pharmaceutical companies have a huge problem of inflating their costs on their medications. I understand things cost, but dude, sometimes I'm going to call this one out. Eliquis does not cost $500 for you to make. And that's the insurance price. Bro, like what? What? And then the other laws, however, that's not this story. The pharmaceutical companies are now saying, hey, we want this to go away because we think that hospitals are disadvantaging us and then that patients or hospitals or whomever is getting reimbursed from Medicaid. And so basically y'all are double dipping and we're not getting paid the amount we need to get paid. So my solution, we need to audit this system. We need to audit, one, the cost of how much it costs to make these medications. Two, how much they are charging for medications. Three, the process for which people are going and getting paid for these medications and how much the government is paying, because I couldn't find that number. How much the federal government or US aid or however it's getting paid. Because a lot of the legislature wording on this, the legislation wording, whatever wording on this act goes back to the Social Security Act. So I would like to see how much they're actually spending of government money, i.e. our taxpayer dollars, for this. And two, I want to see how much the pharmaceutical companies are paying to cover this as well, because it is supposed to be, mostly them. And then we need to audit Medicaid and see if they are actually going out and taking money on top of all of that to reimburse themselves for these medications that are supposed to be cheaper. So here's another audit that needs to happen in the federal government and all of that. So, I don't know. Let's make it happen.